Well, in the interest of time, we will get started and just keep admitting folks as they join. Thank you again for joining us for our quarterly DHS OCI Healthcare Coverage Partnership Forum. We have a number of updates from our work groups today and a couple agency updates for you. So we can jump right into that. I will remind everybody that because this is a Zoom meeting, you have video and mic capabilities, and please use them responsibly. Make sure that you are muted if you are not speaking. And I will take questions in the chat at the end just to sort of moderate that discussion a little bit more cleanly. So please just remember to stay muted throughout. So we can get into the first part of the slides just to get started. So again, here's the agenda. We'll walk through each of our work group report outs, and then we will get agency updates from OCI and DHS, and then take some questions at the end if folks have any. So we'll jump right in. And our first work group is the data work group. So I'm going to hand it over to Kelsey Avery.
Hello, good afternoon, everyone. My name is Kelsey Avery. I am Director of Policy and Association Operations at the Wisconsin Association of Health Plans. I am a co-lead of the data work group. I took over that position from Melissa Duffy at the start of this year. And my counterpart in leading this work is Nick DeMeo, who is a Policy Initiatives Advisor within the Division of Medicaid Services. And our work group has several projects underway, but I wanted to use our time today to provide a status update on what we think is a really exciting project to support data-driven outreach and communications during the public health emergency unwinding. And so as you can see on the slide, the goal of this project is to provide aggregate data and insights to stakeholders to inform and enhance population-level outreach and communications during the unwinding. And so what that means is that the data work group, in collaboration with many other stakeholders, has been working with DHS and OCI to develop a new resource, which I'll refer to as a dashboard throughout this presentation, to help stakeholders obtain and use what is essentially real-time aggregated Medicaid data for outreach and communications purposes throughout the public health emergency unwinding. One thing that's important to note about this data is that it's considered protected health information under HIPAA. So use of the data is limited to supporting outreach and communications efforts. And also the dashboard that houses this data cannot be made widely available. But what we can do is we can produce reports and insights from the dashboard for stakeholders to use and to distribute among stakeholders. Next slide, please, Sarah. Okay, so what makes this dashboard so exciting is that it is very data rich. And for those of you who are on the Public Health Emergency Unwinding Task Force, there are some parts of this presentation that may look a little bit familiar to you because Nick gave a presentation on this topic last week, but wanted to put this in front of the partnership this week. And so on the left-hand side, we have some examples of the types of aggregate Medicaid data that will be available through this dashboard. And this is just to give you, again, some examples to get your brain going and thinking about what this can do. The right side of the slide is a screenshot of a draft, and I should emphasize draft, dashboard mock-up that is meant to help give a sense for sort of how this data is displayed and how it can be manipulated. So again, this is a draft mock-up. The data is illustrative, it's not real, it's all dummy data. And this is, again, just to sort of prime your thinking because it's a little bit easier to look at something visual as opposed to just a list of metrics like you have on the left-hand side of the screen. And again, direct access to this dashboard will be limited, but we can extract lots of reports and information and insights and share that with stakeholders. So if you look at the examples on the left-hand side of the screen, we could use the dashboard to provide information, and again, this is aggregate information, population level information, about the number of cases that are up for renewal, excluding administrative renewals as an example. We could provide information about renewals or applications that were found ineligible and why they were found ineligible. For example, a member may not have taken a required step like completing their renewal or their application. Or we could provide information about renewal submission rates and renewal completion rates. Next slide, please, sir. All right, so the previous slide gave sort of that list of general metrics, and it turns out actually that we can break down that data even further. So again, on the left-hand side of the screen, you've got a list. On the right-hand side, an illustrative visual. So we could break this data down by Medicaid benefit. So for example, whether the enrollee has Badge Care Plus or perhaps SSI. You could break it down by geography. You could break it down by various demographics. So for example, we could actually provide aggregate data about upcoming renewals for Black 26 to 35-year-olds in Milwaukee County. And you can, if you peer a little bit closer at the right side of this slide, on the left panel, that blue panel, you can see sort of how those filters could potentially be applied and flow through across this entire dashboard, and really help you drill down on the kinds of characteristics that you're interested in. One thing I do want to highlight is that because this is protected health information, filters are applied to it and the result is a number that is 10 or less, the data will be suppressed in order to protect that information. Next slide, please. All right, so the last couple of slides, I think, have hopefully given you an initial sense for sort of the power of this data and how it can be used. I'd like to use the next couple of slides to kind of put a fine point on that. So some big picture examples. For example, you might use this data to identify trends in specific geographic regions or among specific populations. You could use the data to inform communication strategies. For example, depending on the demographics of renewals up in an area, you may decide that a social media campaign may be better than a traditional media buy. It may also inform the development of linguistically appropriate marketing materials, or help you as you think about your organization and its workforce capacity needs, culturally and linguistically appropriate staffing for enrollment assistance. Next slide, please. And then to give you sort of a statewide example, so let's say, we use this heat map on the right-hand side. We could identify the top 10 counties with the most members that are up for renewal each month. And then from that, we could also generate aggregate demographic characteristics of the individuals in those counties. So that could potentially inform targeted media buys, planning for local outreach events, connecting with community organizations, schools, other partners. Next slide, please. And then really drilling down into some very targeted examples. These are just, potential organizations. This is not meant to be comprehensive, and certainly, some of these insights could be applied across many organizations, but let's take the top one as an example. Let's say you're an enrollment assister organization, and the data tells us that a disproportionate number of Latinx members ages 16 to 26 in southeastern Wisconsin are failing to submit their verifications. You might then decide to boost messages to that demographic of folks over social media that end up promoting the use of the My Access mobile app for our tech-savvy millennials and Gen Zs, and make sure to boost the awareness of the full application process and what's necessary to be able to complete it. If you are a qualified health plan, we could potentially have the number and the demographic breakdown of individuals in central Wisconsin who've lost Medicaid eligibility but may still need healthcare coverage on healthcare.gov as an example. So with that information, you could differentiate QHP marketing to that region based on any number of demographics like age, race, ethnicity, or primary spoken language. Next slide, please. So we are sort of in the throes of this work right now, and we have some requests of stakeholders, primarily around helping us use this data, help us translate this data into action. So there's sort of two takeaways and asks of folks on this call. The first is to stay tuned for the announcement of a webinar that will take a deep dive into this data and the reports. What we have today obviously is fairly static. What we are building will be dynamic, and it probably helps if you can sort of interact with it a little bit more meaningfully. So we will get to that point once we have the IT built out enough to be able to do that. And we also want to understand your information needs. We've collected a lot of stakeholder input throughout this process to inform the development of this dashboard. But we want to make sure that what we're pulling out of it is going to meet what people need in order to be able to drive their communications and outreach efforts. And then the second ask is, again, help us prepare to translate this data into action. So we would ask you to evaluate the population level outreach and communication data needs of your organization or organizations that you work with throughout the public health emergency unwinding. And so really, what population level questions will you want answers to in order to inform, enhance, and improve your outreach and communication strategy? So we're really excited about this work. We're going to be rolling sort of the prep work and this out over the course of the summer and then through the initiation of the unwinding. So if you have any questions or any feedback, please feel free to contact me and Nick. And in the meantime, please stay tuned for what's to come next.
Thank you, Kelsey. So then we will go on to our marketing work group, and I believe the other Kelsey is giving this update.
Yes, I am. Thank you, Sarah. Hi, good afternoon, everyone. My name is Kelsey McDermott, and I co-lead the marketing and promotions work group with Stephanie Sievers. So far, this work group has been working on messaging ideas and plans for the public health emergency unwinding and open enrollment. We've been reviewing groups impacted by the unwinding and also sharing messaging from DHS's Unwinding Partner Toolkit. We've been providing feedback on new print and digital marketing materials for Covering Wisconsin, such as the lower right corner social graphic. And then there's also a new tool that's now live on Covering Wisconsin's website and the wiscover.com website. It's an interactive consumer web chat tool that provides health insurance options based on information that you provide. And it can also connect you with one of Covering Wisconsin's navigators. Coming soon, it will be available via text messages as well. So you can see screenshots of the tool on the right-hand side of the slide. Covering Wisconsin is also putting together a how-to sheet for folks that are losing Badger Care Plus. So that'll be on their website soon. The work group is also assisting with radio scripts for fall health insurance radio ads. So those will be running September through October. And lastly, content on wiscover.com is currently being reviewed and refreshed. So new information regarding the public health emergency unwinding and special enrollment periods will be published soon.
Great. Thank you, Kelsey. And the marketing group. Sounds like I'm having trouble with my audio, so I'm just going to try to hold I'm seeing nods. Okay, I'll just hold it up here. Technology today is not my friend. So we will go on to the outreach group and I will hand it over to Courtney.
Thanks, Sarah. Hi, everybody. My name is Courtney Harris, and I am the Outreach and Partner Relations Manager at Covering Wisconsin, and I'm also the work group lead for our Outreach and Education work group. So I'm just going to touch on a few of the outreach priorities that our work group is focused on right now, and then give an update on the Covering Wisconsin Mobilizer mini grants that I shared at our last quarterly meeting, in a place where we're looking for some input from this group. So just a few of the priorities that our work group is engaging in right now in relation to the public health emergency unwinding, but really these are kind of ongoing priorities that our work group stresses in relation to just health coverage in general across all key periods of enrollment. So first, of course, we are continuing to seek opportunities to strengthen relationships with some really key partners that will be essential for referrals and helping folks connect to enrollment assistance, but also to coverage and the steps that they need to take to prepare for the end of the public health emergency and also to successfully move through that process. So including working with our partners at the 211 helpline and ensuring that they have the training and information that they need to connect folks who call them with assistance. And then of course, partnering with our income maintenance agencies as well. Another place where we are always looking for more input from other partner organizations is in conducting community partner outreach and training and helping us to identify the communities that are most at risk or most vulnerable to kind of falling through the cracks at key periods of coverage transition, like the public health emergency unwinding. For example, our work group recently identified, very importantly, a need to connect to community partners who are serving individuals who are in unstable housing or maybe experiencing homelessness, and therefore may be most at risk of not being notified through the traditional forms of agency contact, like snail mail, for example, letting them know when and how to take action at the end of the public health emergency. So we've been successful in working with some partners in other areas of DHS, actually, to connect to some really important on the ground outreach community-based organizations who are connecting with individuals in this situation, making sure that they are prepared with information about the unwinding so that they're ready to help folks through this process. We're also, of course, really focused on supporting the tailoring and dissemination of our outreach materials. So the Covering Wisconsin Toolkit materials that Kelsey just mentioned, but also the Public Health Emergency Unwinding Partner Toolkit that DHS has put together and continues to update with resources. We're continuing to support community partners in tailoring those resources and getting them printed and distributed as well. And then just, working really closely with our data work group partners and Kelsey's update earlier, thinking through how we can use those really wonderful dashboards to help plan and modify our outreach approaches as we learn more about where folks are experiencing the most issues. And then I'll just do my kind of perennial plug before I move on into the mobilizer update, that your input, especially in an area like outreach, which is kind of never ending and ongoing, and can always use more voices in the room in terms of especially identifying key community partners that we should be connecting to. So if you're interested in joining this statewide work group and adding your voice to help us identify priority areas or groups that we should be connecting to, please reach out to me and we would love to have you join our work group. And on the next slide, like I mentioned at our last quarterly meeting, as a result of one of our work group recommendations to have DHS support funding of community-based organizations or mobilizers who are really focused on spreading the word about key health insurance transition periods and opportunities to enroll. Covering Wisconsin received some funding that we are putting towards mobilizer mini grants. In the context of the public health emergency, these grants are really focused on spreading the word about these upcoming Badger Care and Medicaid changes and where folks can get help in their community. And through those grants, in addition to the small amount of funding that we provide, we also do a small group training. We did a first training today, actually, of our first small group of mobilizers that we're starting with right now. And then we provide support for tailoring, printing, ways to use those outreach materials, and then just general technical support to help community-based organizations through this process. Like I said, we just started with a first very small group of mobilizers right now to help us spread the word about these upcoming changes and how folks can prepare. But as we move ahead through the summer and into the fall, we will be doing an additional round of these grants. And I would really be interested in hearing from you all if there are particular organizations that you think are well suited to help us spread the word about these changes in the community. So please feel free to reach out to me if you have ideas or you're just interested in learning more about these mini grants. Thank you.
Thank you, Courtney. And so now we're going to go on to workforce and capacity, and I will hand it to Bobby for this update.
Thank you, Sarah. The workforce and capacity work group has primarily been working on public health unwinding issues and working with the public health unwinding task force over the last many months. As we know, the unwinding hasn't started yet, but the process we have been working to prepare for is still ongoing. The unwinding of the public health emergency, the end date is not in sight, but we expect that it will come, although one never knows. With the specter of monkeypox, maybe we'll continue for a while. But we will at some point be ending the public health emergency, I believe, and that work is really important. And the longer it goes on, the more important it becomes in some ways, because less and less people are going to be familiar with the process, understanding the issues that they face, both from an IM agency perspective, although they'll get the training and support and services, but they haven't done renewals in a while. From the consumer side of things, consumers are going to be potentially caught off guard, unsure of what the steps to take. So it's going to require an all hands on deck effort. To that end, a lot of the members of our work group have joined the IM Partner Work Group, which is another work group and emphasis on work. But that group is also seeking new members to help us with sort of task-oriented activities, looking at issues, troubleshooting, identifying potential problem areas, working on resolution strategies, communicating with members on some of the issues that they're going to face during the public health emergency unwinding process. So this discussion is really meant to be collaborative, and it's supposed to be an opportunity to identify these issues in advance proactively. And really, it's a good opportunity, I think, to build relationships between community-based organizations, IM workforce, IM workers, IM leadership, to try and resolve these issues in advance whenever possible. We know that there's going to be quite a big change ahead, and we want to be prepared for it. I'm going to put some information in the chat on how you can express your interest in the work group, and we'd love to have you participate. Oops. Let me see if I can do that again. It didn't really show up very well in the chat. Maybe it's space limited. But we are meeting tomorrow as our first meeting, but that doesn't mean you can't still join, and we'll work to onboard you and help you with getting ready for participation. It's a great opportunity, and I hope you'll join us in our efforts. Thank you.
All right, thank you, Bobby. So now I will share a brief update from our agency here at OCI, and then we'll go into an update from DHS. So I just wanted to share, as we've discussed at previous quarterly forum meetings, that OCI had received a federal grant last fall. And part of that grant is conducting a market analysis that will give us a snapshot of the current state of enrollment in Wisconsin, the plans, kind of the landscape of the market. We would like to identify counties with high uninsured rates and get a better understanding of why consumers remain uninsured, and also look at different types of plans that people may be enrolling in that are not on the exchange, looking at short-term limited duration plans to just get a better understanding of consumer choices. And so we are currently working on a survey to identify some of those consumer choices and understand a little bit more about the landscape of our health insurance marketplace here in Wisconsin. And the intent of the timing of that market analysis was to be able to inform our fall open enrollment outreach efforts. And so at this point, it will also probably help inform some of our PHE enrollment efforts as well. But it just is intended to give us a better understanding of the full marketplace and help us in that outreach work to increase coverage. And then just high level, OCI is continuing to work with DHS and participate in the public health emergency unwinding groups to identify any opportunities that we might have to provide guidance or information to our partners in the insurance space. And so again, because the public health emergency unwinding has been delayed a little bit further, I don't have firm details on that at this point, but we, if you are not signed up for our press releases or our bulletins, you can go to oci.wi.gov to sign up for our mailing lists there to get any information that we would share related to public health emergency unwinding and how insurers can participate in that work to make sure everyone stays covered. So then I'm going to go to the next slide and we'll go through DHS's presentation and we'll take questions at the end.
Great.
So I'm actually not, oh, it is Lisa. All right, great. Didn't know if I saw you on. So there we go. Hand it to Lisa.
Thanks, Sarah. I appreciate it. And I'm actually going to get started maybe with our first update. And I don't think I have control of the slides here. So if we could jump forward to the next slide. Wanted to flag for folks that DHS has been working on an 1115 waiver to CMS to extend our postpartum coverage benefit by 30 days. Ultimately, if this is approved, individuals who are enrolled in Medicaid based on their pregnancy will be able to retain benefits for 90 days postpartum. Today, people are retaining if they're not eligible through any other mechanism, they're able to retain benefits for 60 days postpartum. So we went through a public comment period. We conducted a tribal consultation. Our waiver is posted on our website. And right now, the waiver documents themselves are with the Joint Committee on Finance for a 14-day passive review. Assuming we don't have any objections to the waiver itself, we should be submitting this waiver to CMS likely June 3rd. June 2nd is the final day that the Joint Finance Committee has to raise any concerns or questions with the waiver. So stay tuned. We should be able to implement that in relatively short order once if approved by CMS. So I'll jump forward to the next slide and wanted to just share some high level information about where we are on the public health emergency unwinding and related changes and just do some baseline. We've been talking a lot today about all of the systems and tools that we have in place for when the public health emergency ends. And of course, didn't want to take for granted that folks have a solid grounding in the totality of what that really means. So we'll flag that right during the COVID-19 emergency, the department has been able to implement a number of changes in eligibility related policies and processes for our Medicaid and food share benefits. Those changes have really been intended to preserve healthcare coverage and access during the pandemic, to help prevent food insecurity and to make sure members who are served by our programs had access. Some of these changes have already been rolled back. So we had a 1-year continuation of eligibility for our food share members. We've gone through the process of unwinding that, and folks are back on a regular schedule for redeterminations. Other policies are tied to the end date of the federal public health emergency, which, as we've talked about so far today, we have not been alerted that will be ending. So again, just a quick summary of the policy changes that have been made to date. Right, we've been able to maintain continuous coverage for our Badger Care Plus and Medicaid members. We've been directed to suspend premiums, our Badger Care Plus treatment needs question, our Medicaid purchase plan work requirements have all been suspended during the public health emergency. We've been able to expand presumptive eligibility to our EBD and populations. And we've also been able to provide an additional roughly $75 million a month in food share emergency allotments. So as folks have talked about, again, the unwinding of all of those policies and processes begins when we know that the federal public health emergency is ending. We and many, if not all of you, have been preparing since early 2021 to do this work. So we have a number of system changes we've been working on, messaging for members, coordination with this group and with others. We've been supporting additional capacity for our income maintenance agencies. And I just want to really emphasize this point that we continue to expect to be notified at least 60 days before the public health emergency ends. Secretary Becerra sent a letter to governors a couple of weeks ago, recommitting to this 60-day notice. And our federal partners have confirmed our working assumption that it's fair to anticipate that there will be another 90-day extension of the federal public health emergency, which would bring us to mid-October of 2022. And I'll just underscore that this is a planning assumption, not a guaranteed timeline. But what that means for us is that the next major milestone we are tracking against is August 16th, 2022. Again, that would be the 60-day notice that we would be anticipating for the extension of the public health emergency. And if it does in fact end in October, then November would be the earliest timeline a member might have a change in their coverage. As folks are aware, right, these are our goals and how we are doing this work, right? So first and foremost, our goal is to make sure that we are keeping members covered. So whether that be in a Medicaid program or through the marketplace or another type of coverage that might meet an individual's circumstances, that is the work that this partnership has been doing for many years, and that remains sort of front and center in our work on unwinding. I think we're also aiming to preserve any enhancements to services and benefit delivery, i.e. what did we learn during the public health emergency from the flexibilities we were able to implement, and if there are ways that we can continue to preserve those changes or find ways to preserve those changes. I think that's something we are very interested in doing. Third, right, communication is the most critical piece of all of this. So we want to make sure that we are effectively communicating with our members to avoid disruptions in coverage or care. Fourth, collaboration with all of our stakeholders to make sure we have lots of bi-directional information. And thanks to Kelsey and Nick and the team who shared information about the dashboard this morning. That's one of the ways we can all work together to make sure folks have all the information they need to conduct outreach and support everyone. To the extent we can, we want to be able to support folks with additional funding, staffing, training, resources, and of course, making sure that we're compliant with all of our state and federal policy requirements. So again, at a high level, our plan continues to be that we will distribute our renewals evenly over a 12-month period based on a couple of factors. One, aligning the renewal dates of members within a household. So how can we get a household all on the same renewal timeline? Second, we want to make sure that there has been at least 12 months since the member's last application or renewal. Third, to the extent we can, we're going to align not only eligibility within a household for Medicaid, but also if we have members who are enrolled in food share as well, can we align all of those renewal dates? And then of course, minimizing the time since the household's last renewal. This, as of the previously understood July end of the public health emergency, this was looking to be about 60,000 households to complete a renewal each month. Of course, as the public health emergency is extended, we'll need to continuously update these assumptions based on our current enrollment figures and projections. And I think folks have heard Autumn talk about this in the past, but we also have a smaller population of individuals who have been maintained in our system manually. And for that small population, we will be having them reapply for coverage as opposed to renew coverage. But we'll walk folks through that process. And then for those who have not yet verified citizenship or immigration status, and we have some guidance from CMS making sure that we are able to verify that status by the month after the public health emergency ends. So we will be doing that work between now and the end of the TBD, end of the public health emergency. This, again, I want, as folks are taking a look at this timeline that I know this group has seen before, in your head, if you can move all of this forward by 3 months, because now we are anticipating a middle of October end date to the public health emergency. So again, we expect to be notified in August if the public health emergency will end in October, and looking through the rest of the timeline, again, we will be communicating via mail, via text message, via a number of our partners on the call here today, to both update contact information that a renewal date is coming, and we'll ultimately work through the process to return to pre-pandemic operations. So again, just in your mind, if you can advance this about 3 months based on what we understand to be the new timeline. And again, just want to highlight all of the incredible collaboration. If I could, I don't want to gush, but I really am so grateful for everyone who has been part of this partnership. It's been such an amazing team effort to support all of the Medicaid members across the state. So I want to appreciate our HMOs and managed care organizations who are actively doing a lot of preparations to provide outreach and support to the members who are enrolled in their particular product. Want to thank all of the provider groups on the calls who are engaging with your patients about updating contact information and ultimately about the renewal process. Covering Wisconsin as our navigator organization for providing outreach to our fee-for-service members, and supporting the transition from Medicaid to the marketplace or other coverage. We have, let's skip ahead. Our income maintenance agencies, of course, are doing an incredible amount of work to prepare, make sure that staff are receiving just-in-time training for when the public health emergency ends, and scaling up their efforts. Lots of community-based organizations, mobilizers, engaging in information sharing. Our food share outreach partners have been providing a lot of information for our members and providing great input to our planning, and want to call out the Milwaukee Enrollment Network on this call here today for some of the work you all are doing for on the ground in-person outreach to members. We know a significant majority of our members are in the Milwaukee community, and so just want to thank this longstanding partnership of folks for all of the work you have planned. Our partners at OCI, as always, have been working with us on a wide range of activities, and I know we'll be are actively planning some education for our agent partners, have been working with us on recommendations for our HMOs in terms of marketing. And then our partners at the Division of Hearing and Appeals have also been thinking about what it might mean if we have more folks than have been for the past couple of years transitioning potentially off of the Medicaid program. And so they are also doing some work to scale up their efforts so that they can respond to any hearing requests and do so in a timely way. So just, again, want to appreciate everyone for all of your work in partnership as we continue to plan for and get better at our planning for the potential end of the public health emergency. I think folks have all of these materials, but I'll just again highlight, and we can scroll through these really quickly. Sarah, our unwinding toolkit, Claudine McCarthy, our communications director, continues to update all of these materials on a regular basis. So lots of good things there if you haven't taken a look at them lately. Lots of social media posts. The ones that show up here are DHS branded, but we have ones that are blank where you can insert your own logo and information so that it's branded with your organization's information. These are all available in multiple languages. We have the same for food share as well, so that we're making sure folks are really getting ready. I think that's the end of my slides.
All right, well, thank you, Lisa. And I will go to the final slide that we have here, which just has our next meeting date on it, but we can open it up for questions at this point as well. I will note if there are questions on the data work groups update, Kelsey Avery had to run to another meeting, but I believe Nick DeMeo, not to put him on the spot, but I believe he was on the meeting. And so if there are questions for that, we may be able to answer them now or follow up later. So if you have a question, please put it in the chat. I'll watch it for a minute or so here, and if nothing comes in, we will also follow up with sharing the slides with all of you after this meeting, and you can certainly ask any questions, or I'm happy to connect you with any of the work group chairs after the fact if you decide you want to get involved in any of their work. And again, Bobby has information in the chat, in particular on the IM partner work group. And I don't see any chats with questions coming in. So I think we can wrap up early today and give people a little bit more time on their Monday afternoon. So thank you all for joining us and your continued participation in this work group or in this partnership. Thanks.
Thank you, Sarah.